So, as part of our series of conversations with system leaders across the Cambridge area, as part of our MOU with our great friends at Cambridge University Health Partners, I'm really pleased to be joined now by Stephen Posey, who's Chief Executive of the Royal Papworth Hospital in Cambridge. Stephen, thanks so much for finding the time to be with us today. For those of you that don't know Papworth or the patch particularly well, just want to give us a few lines about the scale of the hospital, where you're located and the services you provide.
Sure. Thanks, Richard, and thanks for the invitation. So, yeah, we're Royal Papworth Hospital. We're based on the Cambridge Biomedical Campus. There's just over 2,000 staff that work here, about 100,000 patients treated here at Royal Papworth every year. And we're the UK's largest cardiothoracic hospital. We're the largest transplant centre for heart and lung in the UK. And we also have a range of other specialist services spanning cystic fibrosis, sleep centre, and then cardiology, respiratory medicine, and of course our surgical division as well. So we're a specialist trust. We serve local people, we serve the region, and we serve the country for a whole range of services that are only provided here for the entire country. So we span a great deal of services on the campus. We work very closely with our partners at Cambridge University Hospitals, Addenbrooke's Hospital and the Rosie. And we moved just a year ago onto the campus in a brand new building, state-of-the-art, purpose-built facility. So about 300 beds. We've got a very large critical care, and we led with our partners the response to COVID within the East of England, becoming the busiest critical care department within the East of England in the first few weeks of the first wave.
Great. So tell us about the move, Stephen. So people of my vintage will know Papworth as being out in the beautiful Cambridgeshire countryside. You say you've been on the Cambridge campus now for a year. How did the move go, and are you pleased with the way things have worked out?
Yeah, it's been a really challenging period for the trust and our workforce. So we moved in May 2019. So we moved our 2,000 staff and all of our patients over a 2-week period of time. 16 miles from the village of Papworth Everard into Cambridge, into this purpose-built building. For a couple of weeks, we were running 2 hospitals during that period. From our perspective, the move went very smoothly indeed. A huge change management exercise, new hospital, new equipment, new layout, single rooms instead of the multi-bed bays that we had at the old site. So a remarkable logistical exercise carried out by the staff here. A few weeks after that, we were met with the CQC for a full core inspection and a well-led inspection. We then had Her Majesty the Queen come and open the hospital 4 weeks after that. We then had winter, and then we had a global pandemic. So staff have worked very hard, and we're really proud of the outcomes we've been able to deliver through the new facility. And we're enjoying very much working with our system partners at the moment on recovery.
And you mentioned the CQC thing. I remember that well. Actually, you had a full house in there of outstanding ticks in the outstanding box, didn't you? So you must be very proud of that.
Yeah, I mean, it's a remarkable achievement, completely down to our staff and their commitment to patient care. But we achieved outstanding in every one of the CQC domains and became the first hospital in the country to achieve 5 outstanding ratings in one inspection. So staff have a lot of pride in that, and I think it's reflected in the outcomes you see delivered here.
That's great. Well, many congratulations again. I know we corresponded at the time. I was hoping a bit of the magic would rub off on one of my own hospital where I have some affiliations. So, Stephen, we can't have this conversation without trying to reflect on what's happened in this really extraordinary time. So, just want to talk us through the journey you've been on as a trust since March, and this thing hit, and we went into lockdown, and systems all over the country. You've alluded to it briefly about the ICU stuff on campus there, but just talk us through what happened to you as a trust, and maybe how that's gone over the past few months.
Yeah, well, I mean, I've mentioned before, it was a hugely challenging period for a group of staff that had been through an awful lot in the year preceding, and in many ways I think it stood us in good stead for the response that we needed to provide. So just to give you an illustration, we'd have probably on average around 27 critical care beds open, and very rapidly as we became aware of the need to respond to the pandemic, that number peaked at around 65 critical care beds that we had open. I think I mentioned before, we became the busiest critical care department in the east of England very rapidly. And as a specialist centre, we were receiving some of the sickest patients with COVID from across the whole of the east of England, actually outside of the east of England as well. We're one of 5 ECMO centres nationally, so you would expect us to be treating the sickest patients. We redeployed around 500 members of staff were redeployed into critical care and other essential roles, such as managing, maintaining PPE. And the whole hospital really changed its dynamic in common with all of our colleagues and other organisations, from the ban on visiting and the toll that took on staff and patients, to the relentless kind of activity that we were required to respond to. We're part of a regional response on the campus here, so work with our partners over at Addenbrooke's Hospital, but also with the East of England to make sure that we had a decision-making cell that could support all the hospitals in the East. And as a specialist trust with those specialist services, we were well placed to play our role in that. We're really proud of the outcomes we've managed to deliver. We've delivered some of the best outcomes in the country for some of the sickest patients, and we're really proud of that. And I think an awful lot of staff sacrifice in terms of working in very challenging situations, unfamiliar surroundings. And there's a lot for us to learn from that, really, which is a huge focus now within the organisation around staff well-being, resilience, making sure that should there be a second surge, and perhaps we're at the outset of that second surge now, what would we do differently? So as an organisation, we're really focused on that continuous improvement and learning. So we've carried out a full debrief exercise for everyone that was involved. There are some themes from that. So we know now if we were to escalate and surge again, there's a whole series of things that we would do differently to better support staff and to learn from that experience. So that's a big focus of our time at the moment, as well as trying to recover the backlog that is obviously existing on our waiting list as a result of that first COVID response.
Okay, we'll come to the backlog in a second. Just in terms of learning, is there anything that really jumped out at you that you learned from the experience?
Yeah, I mean, it sounds quite basic to say it, but actually the importance of communication. So we responded very quickly, and we stood up a lot of additional critical care capacity from equipping the hospital and training and redeploying staff. And in doing that, people responded very well, but actually with it goes a great degree of uncertainty. So people want to know how long they're going to be redeployed for, the areas that they're going to be working in. The contact that they have with their line manager is broken at the point that you redeploy those individuals. So there's a whole series of work that we've put in place now that, should we be required to surge again, means there's a much better network within the organisation to support those staff members. The facilities that we provided for staff as well, that was really important. And we're now finding that there are changes we need to make to our brand new hospital already because of social distancing. So we're doubling the size of the restaurant, the staff changing facilities, the locker rooms. They sound like quite simple things, but they're not at all. So all of those welfare hygiene factors are just so important, and they matter to show that we care for the staff and we want to create the best environment possible whilst they know they're responding to something that's really quite extraordinary.
Great. So let's get on to that bit about the elective care. I mean, people listening to this and watching this will be really interested in how badly hit you were as a trust in terms of your elective work, the backlog that's created. So maybe a few words on that, what you did, and where you are on the way to restoration recovery at the moment.
Well, we're very proud of the recovery. The same people that responded so well to the pandemic are the same people that are working incredibly hard now to restore services. So even when we were in the eye of the storm in terms of the levels of activity, we were already planning for the recovery. So managing the patients on the waiting list in terms of understanding their prioritisation, their urgency. And as soon as we had the capacity to open up, we knew which patients we needed to see first. So maintaining that safety as patients waited. Clearly, 18-week waits, our waiting list grew during the period we were responding to COVID. We've been pretty quick out of the blocks in terms of recovery. We've been aided by the design of the new hospital. We have single rooms here. More than 99% of the hospital is provided through single rooms with en suites. That helps with infection protection control. The fact that we operate on very complex cases within the organisation means we don't have too many cases on the list. So if you think about the productivity loss from IPC and enhanced cleaning regimes from a hospital that does numerous procedures in one list, we actually benefit from the fact that we might only do one patient or two patients on a list. So that's helped us out on the surgery recovery.
Great. And you're going to give us an example of some collaboration with one of the ABHI member companies?
Yeah, so people may know that we worked for a long time now with Phillips, and Phillips have been instrumental in optimising our cath labs and helping us with our recovery. During the peak of the pandemic, they were very helpful as well, delivering some ventilators that we ordered, ensuring that they were ready for use. And I don't mind saying they were deployed rather quickly when they arrived. And I remember the team in our basement building them overnight and getting them out onto the floor. So we've got good reason to be very grateful for the relationship we have with Phillips. We've also rolled out the use of our smart glasses in the cath lab, and they were an innovation with Medtronic, and they were really helpful for us because at the time with the IPC guidelines we needed to reduce the number of staff in the cath labs to carry out certain procedures, and smart glasses gave us that ability. And that's changed things for us. It's helped us get through more patients. It's helped us manage the risk and reassure staff, and it's helped us maintain really good outcomes. So a couple of nice examples there of how that's aided recovery, and the importance for us of those, the depth of those relationships, and the fact that we can workshop these solutions together. We can trial them out here. And one of the things we do like to do in Cambridge is find things that are innovative, but they're actually replicable, not just here on the campus in Cambridge, but nationally and perhaps internationally as well.
That's great. Thanks, Stephen. It's really positive to hear about those relationships. I know all the smaller companies listening in will be heartened to know that it's a really strong partnerships within between industry and the NHS, and certainly things we're trying to look to build on as part of our MOU, and along with our other sort of city region partners as well, sharing that learning. So just finally then, Steve, maybe if you wouldn't mind just having a look ahead. Over the next 6 to 12 months, there's obviously we've got winter to come, and we've got whatever the virus is going to throw at us. But beyond that, we're moving towards integrated care systems. We're all supposed to be part of one in England by April. There's a sense, I think, isn't there, across the system that some of the system working you're describing, the closer, maybe even closer relationships now with your big noisy neighbour on the campus there will have facilitated a move towards some of that. So again, I really just appreciate some thoughts there, and maybe how a specialist provider providing the care as you described, not just locally but regionally, nationally, internationally, how you're going to cope with working across an ICS footprint as well as all the other multiple footprints you've been used to dealing with as a big provider.
Yeah, okay. So, I mean, it's clearly a changing environment, and that is a challenge. But the NHS has always been changing to some extent. I think we're well placed as a specialist trust. We're used to working nationally, regionally, and locally, and our focus tends to be on the patient pathway. So, most of our patients will come to us from other hospitals and other parts of the health system, so we're well used to working with them. But I do think that what's coming is going to be very different indeed, in a good way. So we're looking as a system here, for example, in Cambridgeshire and Peterborough. We're very excited about the GIRFT recommendations around cardiology and respiratory medicine, which is really focusing on the end-to-end pathway and identifying areas where we can implement best practice and deliver improved outcomes. So we know in this system, we know in this organisation that to do better for patients, perhaps deliver more value, reduce waiting times, and deliver even better outcomes, that there's that onus on working together. And I just link it back to the earlier point I made, Richard, around the collaboration. I think we need to do that within health, but we also know that a lot of the questions we're trying to answer, they need our industry partners, they need academia, and they need health to be looking at these sorts of challenges and the solutions that we can implement. So we've got a nice track record, I think, here in Cambridgeshire of implementing quite innovative pathways that are picked up elsewhere. I think now we're here on the campus, the relationships we have, we're hungry to have more. It's a mindset. It's about making sure we're open and welcoming to people who may well have good ideas that can help our patients. So we're looking forward to implementing the GIRFT recommendations. We're looking forward to embedding through an ICS new ways of working, and taking further what we've already set in train. So it's quite an exciting time. It's an uncertain time with winter and resurgence of COVID possibility, Brexit, and all the other challenges that go with running a hospital and responding to that demand. But I think where we've been means that we're in a much better position than we were 6 months ago. We've learnt a lot about COVID and how to respond, and I think we're better placed to now as a result. So look forward with some optimism.
Well, that's great, and it's a nice optimistic note to end it on. So, Stephen, really congratulations on everything you've done there. Those numbers are really, really impressive. I understand how difficult things are operationally. So, and just let me, on behalf of all our members, thank you and your staff for all the hard. People understand just how hard people have worked over the past few months and how difficult an environment it has been to operate in. I hope you, particularly, and your executive team, have managed to get a bit of downtime over the summer to prepare yourselves for the challenges ahead. We look forward to working with you closely. We'll broker some of those engagements as we mentioned. But thanks again for finding some time today, and we look forward to having this conversation again in the not too distant future.
Thanks, Richard. It's been a pleasure. Thank you.